The nurse is screening clients for those at risk for developing hypomagnesemia. Which of the following factors would increase a client's risk for developing hypomagnesemia? Select all that apply. 1. Diuretic use. 2. Malnutrition. 3. Metabolic acidosis. 4. Hyperaldosteronism. 5. Irritable bowel syndrome. Answer 1, 2, 5. Hypomagnesemia refers to a decreased serum magnesium level normal 1.3 to 2.1 mg, L 0.65 to 1.05 mol. Risk factors for developing hypomagnesemia include use of diuretics and certain antibiotics, e.g., aminoglycosides, amphotericin due to renal loss of magnesium, option 1. Malnutrition or alcohol use due to inadequate intake of magnesium, option 2. Irritable bowel syndrome due to gastrointestinal loss, malabsorption of magnesium, option 5. The nurse is caring for a client with mild hypokalemia. Which of the following meal choices would be most appropriate to offer the client? 1. Chicken soup with pasta and apples. 2. Shrimp in a tortilla with rice and corn salsa. 3. Baked chicken with zucchini and green beans. 4. Steamed fish with spinach and sweet potatoes. Answer 4. Hypokalemia serum potassium level 3.5 mg, all 3.5 mol. L can occur due to loss of gastrointestinal contents, alkalosis, and adverse effects of medications, e.g., diuretics, insulin, albuterol. To treat mild hypokalemia or to prevent hypokalemia, a diet rich in potassium is recommended. Foods high in potassium include fish, avocado, spinach, potatoes, bananas, mushrooms, legumes, and whole grains. For a client with mild hypokalemia, the nurse should offer a meal of steamed fish with spinach and sweet potatoes, option 4. 3. The nurse is planning a staff education program about prescribed diets. Which of the following information should the nurse include? 1. A full liquid diet should be implemented 12 hours before surgery. 2. Thickened liquids should be avoided for clients with dysphagia. 3. Carbonated beverages are not allowed on a clear liquid diet. 4. A soft diet should be provided for clients with mucositis. Soft diets include thickened liquids and soft, pureed foods, e.g., eggs, pudding, pasta, fish, cottage cheese. A soft diet is indicated for clients whose diet is progressing, advancing from a liquid to a regular diet, and for those with dysphagia, difficulty swallowing, or mucositis. Mucositis, painful oral mucosa, can lead to alterations in taste, decreased oral intake, and dysphagia. A soft diet helps decrease pain during meals and promotes optimal nutrition, option 4. 4. The nurse is planning a staff education program about seizure precautions. Which of the following information should the nurse include? Select all that apply. 1. Place blankets or pads on the side rails of the bed. 2. Ensure oxygenation supplies are available at the bedside. 3. Suction the mouth during a seizure if the client has excessive secretions. 4. Place the client in the supine position if seizure activity begins. 5. Reduce the lighting and noise in the client's room. Answer 1, 2, 5. Clients experiencing seizures are at risk for injury and airway compromise. Seizure precautions should be implemented for all clients at risk for seizures, especially those with a history of seizure activity. Appropriate interventions include applying padding to the side rails of the bed to prevent injury during clonic seizure activity, keeping supplemental oxygen, a bag valve mask resuscitator, and endotracheal intubation supplies at the bedside because of the risk for airway occlusion, aspiration, apnea, and impaired respiratory effort, reducing environmental stimuli, e.g., lighting, noise, because increased stress from stimuli can trigger seizure activity. 5. The nurse is caring for a client who has streptococcal pharyngitis and is receiving penicillin V. The nurse should recognize that the medication works by inhibiting 1. Formation of folic acid for bacterial growth. 2. Synthesis of bacterial protein. 3. Synthesis of DNA for bacterial replication. 4. Formation of bacterial cell walls. Answer 4. Penicillin V is a penicillin antibiotic used for the treatment of certain infections, e.g., streptococcal pharyngitis. Penicillin antibiotics inhibit formation of bacterial cell walls by inhibiting transpeptidases and activating autolysins. The result is a weakened cell wall that is susceptible to lysis, which causes bacterial cell death. Because penicillins kill bacteria, they are considered bactericidal antibiotics. 6. The nurse has attended a staff education program about tracheostomies. Which of the following statements by the nurse would require follow-up? 1. The indications for a tracheostomy include prolonged mechanical ventilation. 2. The inner cannula should be cleaned frequently or replaced if disposable. 3. An occlusive dressing should be used to cover the stoma if the tube of a mature tracheostomy is dislodged. 4. Clients receiving mechanical ventilation via tracheostomy may receive enteral nutrition through a nasogastric tube. A tracheostomy tube is an artificial airway inserted into the trachea. Accidental decannulation or dislodgement of a tracheostomy tube is a medical emergency. If this occurs in a client with a newly placed tracheostomy, the stoma should be covered with an occlusive dressing and the client should be ventilated via bag valve mask resuscitator. 7. The nurse is reviewing new medication prescriptions for a client who is receiving valsartan. Which of the following prescriptions should the nurse clarify? Select all that apply. 1. Enalapril. 2. Ibuprofen, 3. Metformin. 4. Atorvastatin. 5. Potassium chloride. Answer 1, 2, 5. Angiotensin II receptor blockers ARBs reduce blood pressure by inhibiting the actions of angiotensin II in the renin-angiotensin-aldosterone system. Medications contraindicated for clients receiving ARBs include ACE inhibitors, NSAIDs, and potassium supplements. 8. The nurse is teaching a client who has a new prescription for a dry powder inhaler. Which of the following statements by the client would require follow-up? 1. I will shake the dry powder inhaler before each use. 2. I will exhale away from the dry powder inhaler before I use it. 3. I should wait 20 to 30 seconds between inhalations. 4. I should hold my breath for 5 to 10 seconds after inhaling the medication. Answer 1. Dry powder inhalers DPAs are often used for long-term management of asthma and chronic obstructive pulmonary disease. DP is work by dispersing medication as a fine powder throughout the lungs when the client inhales. DPs should not be shaken prior to use because this could dislodge the medication. 9. The nurse is evaluating the effectiveness of the medication regimen for a client who is receiving famotidine. It would indicate that the medication has been effective if the client is reporting decreased 1. Appetite, 2. Diarrhea, 3. Heartburn, 4. Steatorrhea. Answer 3. Histamine to receptor antagonists H2RAs e.g. cimetidine, famotidine. Nizatidine block H2 receptors on parietal cells and are used to treat peptic ulcer disease. Blocking of H2 receptors reduces the number of hydrogen ions released, which limits the availability of ions to bind with chloride to form hydrochloric acid, i.e., gastric acid. 10. The nurse is planning a staff education program about caring for clients who have experienced an intrauterine fetal death. Which of the following information should the nurse include? Select all that apply. 1. Offer the parents an opportunity to hold the infant. 2. Discourage the parents from taking photographs of the infant. 3. Attach the facility's designated signage for fetal death to the maternal client's room door. 4. Ask if the parents would like a visit from a spiritual support person. 5. Avoid asking the parents questions about the infant. Answer 1, 3, 4. Supportive care for clients who have experienced an intrauterine fetal death includes offering the parents opportunities to view and hold the deceased infant, attaching facility-designated signage to the room door, asking the parents about preferences for spiritual support, and obtaining keepsakes and photographs of the infant. 11. The nurse is screening clients for those at risk for developing hypermagnesia. Which of the following factors would increase a client's risk for developing hypermagnesia? 1. Malnutrition. 2. Hyperparathyroidism. 3. Glucocorticoid therapy. 4. End-stage kidney disease. Answer 4. Hypermagnesia is an elevated serum magnesium level, i.e., greater than 2.1 mEq, a 1.05 mol. Signs and symptoms include nausea, diminished or absent deep tendon reflexes, somnolence, bradycardia, and hypotension. Severe hypermagnesia may progress to respiratory failure, flaccid quadriplegia, or even cardiac arrest. Risk factors for hypermagnesia include end-stage kidney disease due to impaired excretion of magnesium by the kidneys and excess intake of magnesium. 12. The nurse is assessing a client with suspected hypomagnesemia. Which of the following findings would support a diagnosis of hypomagnesemia? 1. Polyuria and muscle weakness. 2. Flaccid paralysis and constipation. 3. Lethargy and dry mucous membranes. 4. Seizure activity and a positive Kvostek sign. Answer 4. Hypomagnesemia refers to a decreased serum magnesium level normal 1.3 to 2.1 mEq, L 0.65 to 1.05 mol/Vel. Risk factors include diuretic use, malnutrition, alcohol use, irritable bowel syndrome, vomiting, and diarrhea. Clinical manifestations of hypomagnesemia include ventricular dysrhythmias, e.g. torsades de pointes and neuromuscular excitability, e.g. seizure activity, positive Kvostek and Trousseau signs, tremors, hyperactive reflexes, similar to those of hypocalcemia. 13. The nurse